For the last 28 years, North Coast Health has been standing in the gap. Our ministry grew from a small one-evening-per-week clinic to a full-time medical office, serving individuals and families with acute and chronic health concerns. Holding true to our founding principles, North Coast Health, a faith-based charitable clinic, believes that all lives are valuable and continues to bridge the gap to affordable health care.
Our mission has not changed. We have the constant of our faith background, faith traditions, our values of treating everybody with dignity and respect. None of that has changed for us.
North Coast Health has been in our community for more than a generation, providing primary care, specialty referrals, prescription assistance, and health education to the medically underserved. As an NCQA-recognized, patient-centered medical home, we are providing care that has been proven to result in greater equity in health outcomes for some of the most economically vulnerable in our community.
I've been a patient here at North Coast Health for about the last 6 years. I was referred to them through Fairview Park Hospital. I suffer from Crohn's disease, and it's been a problem I've had ever since I was a teenager. The only way I could get any follow-up done to treat the Crohn's disease was through North Coast Health. Thank God they were here. The one thing I told people many times is that they always make you feel like you're the only patient they have. And everybody I've talked to says the same thing.
I was very fortunate to have found North Coast because at that point, I was pretty much beat down pretty well, not able to work, not having any health insurance. So even people who are stuck with minimum care, old prescriptions, they haven't seen a doctor in a couple of years, those people are very, very beneficial when they get to a place like this.
Despite the many changes transforming our nation's healthcare system, the need for our service continues. Anticipating the complexity and requirements this new legislation would have on our patients, North Coast Health recruited and trained volunteer certified application counselors to help navigate the system and enroll patients in programs best suited for their individual needs.
As a certified application counselor, we volunteer to help patients and guide them through the Affordable Care Act. When I signed up to be a volunteer at North Coast Health, I did it primarily because I believed in their mission statement. I love their mission statement. I feel that there are many people who fall through the cracks who are not covered by health care, and it's such an important part of the quality of our lives that if there was anything I could do to improve that, I would.
When I first came to North Coast, it was in January of 2013. I was a mess. I didn't have medical insurance at the time. I had just lost my job about a year earlier, and I really needed some medication. Since I've come to North Coast and did my homework that the doctors and the counselors and everyone involved have given me, I'm a healthy 54-year-old now. I still have a pinched sciatic nerve. I don't know if that's ever going to go away. I still have asthma, and I still have a lot of other problems in my life. But with the places and people he sent me to and his help medically, I am here to tell you that this is a great place.
In addition to those not covered by the ACA, there are still thousands more falling through the new and changing gaps to affordable care.
People often ask me, as I work at a free and charitable clinic, how has healthcare reform changed things for you? It's made it better, right? In most cases, yes, but being on the front lines, I work with patients every day who are still caught in gaps in that care. And those gaps are different gaps, but they're still there. But being able to help navigate through this very confusing, changing landscape of healthcare reform has been challenging, but we're honored to do it.
When I first heard about the Affordable Health Care Plan, I was concerned about it. I didn't really understand it. North Coast helped me by setting me up with an interview with a navigator who kind of explained it to me, and she told me that for both of us to have health care, it'd be only $250 a month. And it was affordable. It sounded affordable, but I don't have $250 a month.
Without North Coast, we wouldn't have any place to turn. We wouldn't have anybody to help us with we both have ongoing health issues. We wouldn't have any medication, any way of obtaining that kind of thing. So, I mean, for us, it's vital that they're here. They saved my life. Without Dr. Tomsick and all the people here, I would be dead now. I have cancer, and I never would have known that without them. All of the issues that go on with big hospitals, North Coast navigated it all and made it really easy for me to get the treatment that I needed.
North Coast Health remains committed to our mission of providing quality health care and improving access for the most vulnerable in our community. We anticipate the need for our services will grow as the healthcare landscape shifts in the coming years, but even with the best foresight, there are new gaps to accessibility opening every single day. We view it as our responsibility to stand firmly in that gap.
Don't hesitate if you're referred to North Coast. Please don't hesitate on coming in and talking to these people. They can really be a godsend.
Today, we've got North Coast Health, and we're grateful for it.
Yes, we are.
My granddaughter, Dahlia, it will be her first birthday, and I have been able to be there every step of the way. And if I wouldn't have gotten all this help, I might not be in that little child's life. Thank you so much.